Well, I found out I had prostate cancer actually right when I turned 50 years old through the incredible work of Stan Hall, a doctor at Roper Hospital. He actually was the one who led me to diagnose my problem. I had no symptoms at all. I'm a runner. I had a little bit of an injury that I thought maybe was a pulled oblique muscle. And I went and saw a few doctors, and by the time I got into Stan's office, he asked me a couple questions about my health, my age, and my history of getting tested, and he suggested I do a blood test, and literally from that blood test, I found within just a couple days that I was positive and had prostate cancer. The next steps really were pretty easy for me, and that was I had such good medical care and advice. They led me down the road to where I needed to go, which was to get treated and to do it in a positive way. And so I literally followed the advice of those who were around me and ended up with Roper St. Francis and Denny Kavinsky having prostate surgery. As you know here, there's a lot of options in this medical community, and I weighed all the options, was given lots of good advice from the medical community, and had the robotic surgery, and it literally, from a horrible diagnosis, really changed my life. And I can tell you, as I stand here today, some 2 years later, so much more for the better. Oh, I feel great today. 2 years after surgery, I've never felt better. I've never had a more positive outlook. I am cancer-free, healthy, and in a position where I can tell people who do have a diagnosis, if you unfortunately do, it's really not the end of the line, it's the beginning of a journey that can really change your life for the best. And it clearly has for me. I know that you can say that, but for me it's been an unbelievable 2 years, and I think going forward will be a fabulous opportunity for me to give back to the community and to help people who get diagnosed, because I was young enough and lucky enough to be able to have this procedure and come out of it on the other side, cancer-free, healthy, and with a very positive outlook. If in fact you have any question about whether or not you should get checked, my answer is yes, you should get checked. There is nothing bad about getting checked. The thing that's bad is not getting checked. So if you're a man over the age of 40 or 45 with any history, or 50 like me, go see a urologist, have a conversation, get a blood test, and you will live a long and happy life.